Marissa mentioned, we're going to spend the next about 20 minutes before jumping into an activity discussing how to define and engage with end users and stakeholders. So referencing Craig's feasibility, desirability, viability framework, this presentation is really focused on that desirability piece. So understanding the market and the end user stakeholder needs, desires, and challenges. We understand that some of you may have already engaged with stakeholders previously, which is absolutely fantastic. But we hope that throughout this presentation, you'll hear some new best practices or tips and tricks that you could implement in future stakeholder engagement. We hope that you'll understand that there's different types of stakeholder engagement that you can do throughout the development process, and hopefully learn about, some new types of stakeholders that maybe you hadn't considered engaging with previously. So this session is really proposed to help you prepare for the activity that will follow for the remaining 25 minutes of this session. Please feel free to pop any questions that you have throughout the presentation in the chat. Emily or myself will do our best to respond to those, and we'll also have a quick Q&A session at the end if you prefer to hold on to them until then. Emily, next slide, please. Awesome. So I'd like to just first start by discussing the benefits that stakeholder engagement can bring you when you're developing a new product. And at a high level, these benefits include better understanding the operating environment. It can help to inform the development of your product. It can help to build awareness within the industry of your product or innovation. And each of these areas are equally as important to consider. So diving into understanding the operating environment a little bit, engaging with stakeholders will let you better understand and confirm that clinical unmet need that you're working to solve, to really help ensure that you're smartly innovating in the space to help overcome and solve that need or challenge. It can help you understand limitations or challenges with currently available options, which could include standards of care or competitors who are in the same space as you. It can also help you understand the impact that your product will have on that clinical workflow, as well as the patient life, to really help make sure you aren't disrupting that workflow too much or increasing the patient's burden with your product. Now, engaging with stakeholders to better understand the operating environment is really important to do so early in the development process. And this will help to ensure that your product is, again, helping to solve those challenges, rather than getting through, the prototyping or that proof of concept stage, then taking it to end users and stakeholders and hearing that what you've developed isn't really actually helping to solve their challenges. Shifting to informing development. Engaging with stakeholders, for example, if you are considering multiple indications, this engagement could help you better understand which indication has the most critical unmet need. And this could really help inform a first target indication. And if you already have a target indication, for example, the engagement could help you better understand if there's a certain subset of patients that would be most amenable or most in need for your product to target first. It can also help you to inform needed functions and features that clinicians or patients would look for in a new product. For example, it could help you consider preferred routes of administration for a new therapeutic, length of time between dosing. Could also help you better understand certain design requirements that might be required on a new medical device. Finally, it could help you to better understand potential barriers to adoption, and really knowing if there's going to be some sort of additional education that's needed in tandem with your product to have stakeholders really understand how it works and the potential benefits it would bring. Finally, for building awareness, engaging with stakeholders could help you to identify champions of your product that could be first adopters, could help you identify individuals who could be interested in collaborating with you throughout development. It will also help to expand your network of key opinion leaders and really, again, just build that general awareness and excitement for the product in the industry. Next slide, please, Emily. Great. So we've boiled down stakeholder engagement to 4 main steps, as you see on this slide. That's identification, outreach and scheduling, preparation, and synthesis. So over the next 15 minutes, we'll be taking a deep dive into these 4 main steps, but just a brief high-level overview: identification, identifying the right experts to speak to, and ensuring you're considering the entire ecosystem. Outreach and scheduling will give you some tips and tricks on how to send effective requests to get the right experts to talk to you. Preparation will include some information on how to prepare custom and impactful questions to make the most time out of your interview. And then for synthesis, we'll help you understand how you can better capture all of the data that you've captured throughout that interview. Now, I'll note here that this is an iterative strategy that's really important to do throughout the development of your product and at different stages for different reasons. So again, early in development, stakeholder engagement can help you confirm those market needs and challenges, whereas later in development, stakeholder engagement could be used to help understand how the value propositions of that product are resonating with the stakeholders and end users to, again, really make sure that your product is solving their challenges that they are facing. Next slide. Perfect. Thank you. Now, when we say stakeholder, it can mean a lot of things. So I'd like to just spend a couple of minutes talking about the different roles that stakeholders can play. And I'm sure we're all, really familiar with typical roles of stakeholders that can include end users, customers, champions, and decision makers. So I'll just point out a couple that maybe you hadn't necessarily heard of before. So that could include influencers. Now, this type of stakeholder role is very similar to champions. Champions are advocating for a product's adoption. Influencers won't necessarily be directly advocating for the adoption of a product, for example, in a hospital system, but they'll still weigh in on that adoption process, be important to promote the importance of why it should be adopted, and they'll typically be very excited by the value propositions of your product. Beneficiaries are the stakeholders who are actually standing to benefit from the product itself. They have a vested interest in successful outcome. And saboteurs, they're a bit more on the negative side. These types of stakeholders maybe don't like change, maybe they push back against adoption. And that could be, for example, because they feel as though they would be negatively impacted. Maybe it changes their workflow that they're used to just a little bit too much, and they wouldn't necessarily like that change. So just very quickly to give you some broad examples of types of stakeholders that could fall into a few of these roles: end users, clinicians, technicians. Beneficiaries could be patients, caregivers, decision makers, could be clinicians. And I mentioned clinicians multiple times because sometimes stakeholders play multiple roles throughout that adoption process. So just keep that in mind. One stakeholder could be an end user, but also a champion and a decision maker. Next slide. Thank you, Emily. Now, when you begin identifying potential stakeholders that you'd like to engage with, it's really important to seek perspectives that are outside of your network. And we're not saying, don't talk to your colleagues or your coworkers or your friends. That's a great first step to take. But just keep in mind that the people that you're close with are less likely to give you their unbiased feedback or tell you what needs to be improved in your product, what they don't like. And that's why it's really important to expand out from that internal network for more unbiased feedback. We understand it's a daunting task to do that, to go out and find stakeholders that you don't necessarily have a connection with. So some good places to start searching for those types of stakeholders could include professional societies or patient advocacy groups. You could attend conferences or networking events. So those are just a few examples of places that you could start. And by doing so, your network will grow naturally over time. And when identifying these stakeholders, it's really important to consider the diversity of the types of stakeholders you're speaking with. So for example, years of experience. Someone in the field for 25 plus years will probably have vastly different opinions and perspectives than someone who's a bit newer, maybe straight out of med school, for example. Geography is an important consideration. Coastal cities tend to get newer technologies a bit faster than cities that are more central to the US. Large versus small cities and clinics may have different funding limitations and opportunities, and then academic versus community hospitals. So really, again, having a diverse perspective from different stakeholders throughout that ecosystem will really allow you to understand different perspectives that you should consider as you continue to develop your product over time. Next slide, please, Emily. Wonderful. So in tandem with, considering different perspectives and types of stakeholders beyond your direct network, it's really important to consider speaking with different types of stakeholders, in the entire ecosystem of those who could be potentially impacted for your innovation. So on this slide here, you can see, we drew out an example for you. And this is around, if there was a new insulin pump under development. You wouldn't want to just speak with the patients and the primary care physicians that this new insulin pump would impact. You'd also want to go out and speak with other stakeholders that could potentially be impacted by this product. That could include nurses, endocrinologists, ophthalmologists, dietitians, pharmacists, podiatrists. So there's a lot of different stakeholders that this new product could potentially impact. And it's important to consider their perspectives as well, even though they're a little less directly related to that direct clinician-patient kind of feedback that you would definitely want to consider throughout this type of engagement. So I think with that, I will pass it over to Emily, who's going to dive into some of the other topics that I mentioned at the beginning.
Yeah, thank you so much, Brailey. So I'm going to be jumping into the second step of our 4-step process that we boil down for engaging your end users and different stakeholders. And so as Brailey mentioned, finding the right people and right types of stakeholders to engage is a critical first step. You want to make sure that you're having the right conversations with the right people. But another critical step is actually getting those right people to respond to you. Especially when you're, going outside of your network and maybe sending some cold emails or having some cold conversations with different clinicians or experts. And so in the next few slides, we're actually going to walk through some tangible examples of types of outreach that you could be sending out to different experts, as well as some, maybe best practices and watch-outs with these examples. So one caveat that I will mention is that, the examples that we're about to walk through in these slides are for more formal engagements, right? You're going to send an email or maybe a message on LinkedIn to an expert or a stakeholder outside of your network. We also want to encourage you to kind of use informal collisions and random connections with folks that you might find at conferences or networking events, different associations. So make sure, if you're at a conference and you're sitting down, for a talk or walking from one symposium to the next, to try and utilize those kind of random interactions you might have with different clinicians as well. But these, guidances and best practices are going to be more for your more formal stakeholder and end user engagements. Okay, so I've kept you in suspense long enough. I'm going to flash an email up on the slide. So I want you to take a second, read this email, and as you're reading it, I want you to kind of put yourself in the expert's shoes and think, would I respond to this email if I received it? If your answer is no to that question, I'd love you to pop into the chat why you would not respond to this email. So I'm going to give you all just a few seconds to read it. Okay, that's one example. I'm going to go on to the next one. So I want you to do the same activity. I want you to read through this email and have that same question in your mind. Okay, would I respond to this email? And I'm curious that if your answer changed from no on the first example to yes on this example, I'd love for you to pop in the chat why your answer changed. Give you just a few more seconds to read through. Okay, so we're going to go back to the first email. So one, just first say that email outreach and this type of engagement is an art, not a science. There's never really a right or wrong approach, but there are some best practices. There are some watch outs that you can have in mind as you're starting to engage with different end users or stakeholders. And so we wanted to walk through a couple of those from using this first example. So one kind of watch out on this first email approach is that it's not really personalized to Dr. Smith. There's no call out of why Dr. Smith's expertise is, exactly what the person that's doing the outreach needs. You could basically replace Dr. Smith with any doctor and the email would still stand. So personalization is one kind of watch out. You want to make sure that the interviewee feels like you need their expertise and that they are the specific person that you need to reach out to. Another watch out is there's not really an incentive for an interviewee. We always like to say in our group, you need a carrot for why the person would want to spend time out of their very busy day to talk to you. There's definitely an incentive for the person doing the outreach with wanting to secure a letter for their SBIR Phase 2 funding application, a letter of support, but there's not quite that tie-in of why the interviewee would care. For clinicians, you could think about, will this make their job easier, their life easier? Or thinking about impacts for patients. You don't quite see that clearly called out in this email. Another thing is concise. People are busy. We don't have very long attention spans. I think especially since the pandemic, it seems like our attention spans have shortened, and you're reaching out to very busy people. So you want to get to that point. You want to get to the kind of question that you're asking, the request to meet with them and why it's important extremely quickly. Another thing is it's not really focused on the need. This is a very technology-driven email. You're kind of giving a description of the technology, going into the weeds there, but not really focusing on the problem that you're trying to solve, which again could incentivize the interviewee, especially if they're passionate about their field, to want to speak to you. So again, wanting to kind of make sure that you're emphasizing the why and the impact of why your project matters. And then finally, we always think it's great to pique curiosity. You want to give everything away in the first initial email. We actually find the more detail you give about your technology in that first email can actually make people not want to respond, because they're like, well, I'm not really an AI expert, for example, in this kind of insulin pump example. I don't know if I'd be able to really help with that. So you want to give them enough information to make them want to respond and have some questions in their mind, but not too much. Also, you don't want to go too far to revealing any confidential elements of your technology too. So then if we keep these watch-outs in mind and go back to our second email, we see that there's some improvements. I will say that there's always room for more improvement. This is not a perfect email by any means, but we do see in the second email that it's piquing curiosity. We say it's supporting a project to get to the impact of helping diabetics manage their blood sugar better. It doesn't go into what that is. So the receiver of this email might be like, well, I wonder what they're working on. I wonder if it is a pump, or maybe it's something else. We also see that there's the focus on the need, right? It's not too tech driven. We can clearly see why they're doing this project and why it can matter for the interviewee and for their patients. We also see that the person doing the outreach did their homework. They are connecting it directly to a recent project of the person that's receiving the email. And then finally, there's an incentive, right? If this is a clinician, for example, an endocrinologist, improving diabetic care and blood sugar management, they're of course going to want to hear more. So again, there is room for improvement here. What we suggest when you're doing outreach and crafting these emails is try a couple different approaches. Try different approaches for different stakeholders, try different channels like email, LinkedIn, other platforms, to try and make sure that you're, keeping your outreach fresh and making sure that you're kind of using the right type of outreach for the right type of stakeholders. So going into scheduling, thinking about identifying the right people and getting them to agree to a meeting, those do seem like harder steps than scheduling the meeting. It seems like an easier step comparatively. We still wanted to pass along just a couple quick best practices here. So, Brailey and I have done this quite a bit for catalyzed investigators and other types of projects that we support. And so we've collated, three best practices that, in terms of scheduling these interviews. So 30 minutes, always make sure that you schedule at least 30 minutes for these interviews. Time goes so quickly, especially when you have to set context at the beginning. And, for clinicians, it might be hard to get 30 minutes. If you get 15, I would still take it and really identify those kind of mission critical questions that you must get answered. But really, we do think that 30 minutes is kind of that bare minimum to have a really impactful conversation. But if you can get more, that's great. However, just really be mindful of the time. If you have gotten 30 minutes out of a clinician or other stakeholders' calendar, try to end on time. Another thing that can be helpful in scheduling these is just, looking outside of working hours, especially if you're meeting with healthcare providers. They might have random work schedules, different hour shifts. So just be open to meeting outside of those times to accommodate people's schedules and be flexible to reschedule if something comes up. And then finally, what we found is that having multiple team members on the line is helpful. It's really hard to kind of facilitate and have a conversation and also take really good notes at the same time. I think for humans, that's just a lot of multitasking to do. So we always have, kind of a lead interviewee and a note taker on the call. You could record interviews, but we do find that typically reduces the openness of people sharing during the interview, as well as some folks might just not be comfortable with being recorded and might decline the interview. So if you can't have two team members, that is an option, but it might decrease kind of your candidate pool for who you can speak with. And then finally, in terms of running the interviews, we also want to indicate that having different folks lead the interviews can help reduce bias. It's kind of an interview best practice that people just have a tendency to ask questions a certain way. So having different people lead the interviews will make sure that you don't have any bias, or will help mitigate some of that bias in the ways that questions are being asked. Okay, so we've talked about finding the right people, reaching out to them, scheduling the interview. Now we're getting to kind of one of the most critical steps, preparation. So preparation is probably the step that takes the longest. We use kind of a benchmark in our group of, if you have a 30-minute call, we'll always recommend an hour of preparation time to get ready for an interview. And this preparation time can include, kind of developing your intro, your context, how you're going to open the meeting, developing a customized interview guide, and then doing some homework on your interviewees too. So starting at that beginning step, for each of these interviews, you should start with kind of the purpose of the call, what you're hoping to learn from the interviewee, and then be prepared to share a non-confidential description of your technology. Never share, of course, confidential information with any interviewees without some sort of agreement in place. So come up with a really high-level description of your technology, enough for them to know kind of the main gist of it and be able to answer some questions. We also, before the interview, you should develop a customized interview guide. Typically, what we'll do is create a big bank of questions that we could ask these different interviewees, and then we'll kind of pick and choose based on, the background of the person that's being interviewed. But of course, just remember that it is a guide, and you might have to be agile depending on the direction that the conversation goes. Also, just make sure that you do your homework, do some background searching on the interviewee, look at their recent publications, and just be prepared to, dig into any of that background information. And also, it'll help you kind of customize the questions that you're going to ask them too. Might be helpful to conduct a practice interview before you start engaging with folks outside of your network. You could practice with someone in your network to have an easier kind of go at it and kind of, shop your questions. But really, we think that this also helps in making these interviews conversational. You don't want to sound like you're reading question off of paper and a script. You want to make sure that you're kind of having a conversation and engaging these interviewees, because they'll be able to share information a little bit more freely. Then finally, the only other kind of note in terms of preparation is that this is an initial call. You're kind of building relationships, starting a conversation. Don't get down into the technical weeds. We're not pitching your technology. But you can always, the other kind of silver lining of these interviews is that you can build connections and have further discussions with interviewees, especially, even at a really technical down in the weeds level after you've kind of signed NDAs and had kind of an initial awareness building conversation. So you're not only learning about your technology, you're not only informing development, but you're also building connections too, which is great. Okay. So I'd mentioned that this is just an initial call, that you're not pitching your technology. And actually, this slide is very connected to the activity that we're about to send you all out in just a few minutes. So we wanted to kind of show you some examples of questions and topics that you might be able to ask in an initial call versus questions that you might want to steer away from. So again, you're not wanting to pitch your technology, you're not wanting to show all of the benefits, show data, show the research that you're doing. Rather, this conversation should really focus on, as Brailey had mentioned, understanding your end user, understanding the environment, maybe barriers to adoption, modifications that you might have to make to your technology, to your device, to be able to make it, more inimitable for patients and for clinical stakeholders. So again, these are just some examples. I won't spend too much time on this slide because I think you'll all be getting some really good practice in this for the activity we're about to do. Okay, so moving on to synthesis. So after you've conducted an interview or a couple of these interviews, you're probably going to end up with pages of notes that have a lot of information in them. And so it can be really challenging to go from that, all of the information that you've gained from all these interviews to the good nuggets of, what does this mean? What does this mean for my team? What does this mean for my product, for my technology, etc. And so we've tried to boil down the synthesis step to, again, 4 easy and repeatable steps that you could do kind of iteratively as you're conducting these interviews. So what we recommend is first kind of determining categories of the types of questions you'd want to ask these interviewees. These categories could be around, barriers to entry, competitors or limitations with the current standard of care, features that end users need, and then kind of compiling quotes and, insights from the interviewees as you do the interviews across those different categories. As you do that, you should start to see some themes emerge and some, kind of consensus across the different interviewees. If you're not quite seeing themes, if you're not quite seeing consensus, for us, that's a sign to keep doing interviews, because you're not quite there at that, oh, this is what this means. This is, I can kind of boil down all of this feedback into this critical insight. So once you kind of generate those insights and you've identified those themes, we want you to, think about what does that mean for you. So you kind of got the So what? Now you have to think about the now what. What do you do with that information for your product and for your technology? So does that mean that you need to change the design? Does that mean that you might need to change the patient population that you're targeting, or maybe the endpoints? So then, to generate those insights from those, themes and patterns that you identify from the different quotes and feedback from the different interviewees. After you've gotten kind of the insights, in terms, whether it's, again, product modifications or, shifts in the patient population that you're targeting, we then recommend that you understand how you can integrate those into either external communications, like your pitches. It's great to have anecdotes. It's great to have quotes from interviewees and key opinion leaders, or possibly in future funding applications, right? If you're getting really good feedback about how much of a need there is for technology, it's great to be able to integrate those insights. And then finally, at the end too, this is kind of that iterative part that Brailey had mentioned earlier, just making sure to identify maybe any gaps that you have, like, oh, I really know about kind of the limitations of the current standards, but I don't really know what's going to keep me from, I don't really have a good grasp of maybe potential barriers for my technology to go into market. Then you can go back and have much more tailored conversations with additional interviewees. So to wrap it up, won't spend too much time here because I want us to get to the activity. It is critical to engage stakeholders early in development. There's so many benefits. Brailey did a wonderful job going over those, but really it's just about making sure that you're designing a solution that will have the desired impact that you want it to, and to really inform your development to make sure that you're going in the right direction. Not only do you have to start these conversations early, but be comprehensive. Think about all of the different stakeholders that could have a role in your product development. We talked about, the outreach with our email examples. Who you reach out to is very important, but just as important is how you reach out to be able to make sure that you're securing those conversations with those interviewees. Preparation, we cannot emphasize it enough. If that's the only thing you take away from this talk, that preparation is important for these interviews, I think that's great, because it really can make or break conversation. Remember that these are initial conversations. You're not pitching your technology, but it should be more about listening to the interviewee. Should be probably 20% you asking questions, 80% listening to the interviewee. And then finally, that synthesis part is critical to make sure that you actually can inform the development and know how to use the insights that you're gaining through these conversations.